Hi everybody, this is our last lecture of the course, Health Psychology, which is chapter 15, and probably the most important chapter. We should probably start the course with this chapter because this chapter is going to teach us how to be healthier. So we're going to talk about first psychological factors and general health issues. Then we're going to talk about psychosocial factors and specific diseases, intervention to improve health-related behaviors, and then finally we're going to end on sleep and health. Hopefully all these things can help you through the final exam period and keep you happy and healthy into the new year. So as with the other disorders that we talked about, there's a biopsychosocial model for physical health as well. So there are biological factors like your age, your gender, and your genetics. And then those are intertwined with psychological and environmental factors like the number of stressful events that you've experienced, cultural norms, and psychological factors like behaviors that affect your health, treatment-seeking behavior. Do you go to the doctor? Do you get your mental health checked up? Do you comply with your doctor's orders? And those then all relate to your physical health and your emotional well-being. I thought this was an interesting table. They're talking about the leading causes of death in the United States in 1900 and in 2009. So you see that heart attack, cardiovascular disease or heart disease is number 1 in both cases. But in number 2, we have the flu and pneumonia, 3, tuberculosis, 4, colitis or gastric disorders, and 5 is accidents. Now, if we look at 2009, we see heart disease, cancer, stroke, cerebrovascular diseases, and accidents. Part of that is that we now have better health care, and obviously things like the flu, tuberculosis, we can now treat more effectively, but also the diseases on the right can be more linked to stress, and so so that is something that we're going to be talking about today. So what are some of the psychological factors that affect your health? One is your outlook on life. We know that people who are pessimistic are twice as likely to have a heart attack than somebody who is optimistic. Being pessimistic or seeing the world through the view that the glass is half empty causes arousal of the body's fight or flight response. So it kind of constantly feels like it's in kind of a distress mode, which elevates levels of cortisol, which then decreases or suppresses your immune system. It contributes to poor health. It leads people to engage in unhealthy habits, and it reduces positive coping strategies. So I mean, while it's difficult to change one's overall outlook in life, if you can make yourself more optimistic, that's always a good thing. Put on those rose-colored glasses. The world looks much rosier through them. I know that sounds cheesy, but it's very true. And also your coping strategy. While sometimes avoidant coping strategies are necessary, like immediately following an extreme trauma, if you consistently use those type of strategies, like you don't face the problem head on, but rather just avoid it, it actually causes a lot of health problems and a lot of more serious problems down the road. And it actually, if you use avoidant coping strategies, it actually predicts chronic diseases. There are also gender differences in coping because women experience different physiological changes in response to the fight or flight response. We see that that's less prominent in females because I guess through evolution it was usually males who would do a lot of the fighting in dangerous situations, and women and children would be kind of held back. But these hormonal, the adrenal gland releases adrenaline, norepinephrine in response to these extreme stressors, such that women have actually been able to lift cars off their children or do things to protect their offspring. But women have a tendency to seek support from others, and they have larger supportive networks. And also in times of stress, women tend to release oxytocin, which is the same, here's a senior moment that I'm having right now. I'll have to get back to you on what that hormone that is released is, but it's the same one that's released when nursing, and basically it causes us to form bonds with people. And women tend to be more emotionally, cognitively, and physiologically sensitive to marital conflict. And so when there's a fight in the relationship, women tend to have more consequences than men. Men, on the other hand, have a much smaller network of people they turn to for support. They're less likely to share personal issues or concerns with others. And they're less likely to benefit physiologically from relationships as compared to women. Men tend to drink more alcohol in order to cope with their problems. There are also cultural differences in coping. So Asian people are reluctant to reach out to other people for social support as much as people from certain other cultures. European Americans benefit more from explicit forms of seeking social support than from implicit forms. So they have more, they're more apt to go to groups versus kind of just have support available through the family. So we know that there is a relationship between psychological disorders and physical health, such that psychological disorders can result in physical health problems, very real problems. They may share a common genetic cause of medical illness. They can create medical problems, and vice versa. Medical problems can also create psychological problems. When there's stress in your personal and professional life, your physical health decreases. They found a very linear relationship between the amount of stress you're experiencing and whether you're going to catch a cold. Psychological disorders like depression also lead to people being more pessimistic, and we just talked about all the negative medical or physiological effects of pessimism. It can also increase our negative health habits, so you might be more likely to smoke, to drink, to eat unhealthfully, etc. So if you look at the psychosocial factors in specific diseases, a lot of this is influenced through our immune system. So our immune system protects us from disease by identifying and killing pathogens in tumor cells. So that it's kind of like, the alarm system and the protective system. So when something kind of is bad in our body, like a virus, then the immune system goes to work to getting rid of it. We have an innate immune system which reacts quickly and non-specifically to any microorganism or toxin, but then we also have a specific immune system which is slower and specifically tailored to various pathogens. And both of these systems are affected by stress and negative interpersonal events, such that when you have kind of a little bit of stress actually boosts your immune system, but when you have chronic stressors, it actually suppresses your immune system such that it's not able to perform in the way that it's supposed to, and you're more susceptible to both colds and viruses and things like that. But also there's some evidence that diseases that you've already might have had, like cancer, AIDS, things like that, are worsened by the effects of stress. So cancer is affected by psychosocial factors, coping behaviors, and stress. So a lot of the having negative outlook, all that stuff can work to suppress your immune system, which in turn can then decrease your body's ability to fight off cancer, such that, not that it causes cancer, but you may have a more rapid progression of cancer. We do know that there's a much more direct link between the progression of HIV and from HIV to AIDS through stress. And so your ability to, for the antiretroviral drugs to work depends on lesser levels of stress. We also know that chronic stressors can kind of push somebody who has HIV into actually the AIDS stage. We know that coronary heart disease can be worsened by chronic stress. Coronary heart disease occurs when blood vessels supplying the heart with oxygen and nutrients are blocked by plaque. And complete blockage causes what's called myocardial infarction or a heart attack. Men are more prone than women to heart disease and stroke. Although there are a lot of lifestyle factors and genetic contributors. So we do know that heart disease runs in families. We also know that things like smoking, eating high-fat diets, a sedentary lifestyle contribute. But we also know that stress increases the likelihood of people having heart disease. Hypertension is a condition in which blood flows through the vessels with excessive force. This is also known as high blood pressure, which puts pressure on the vessel walls, can lead to cardiac disease and stroke. It can be traced both to genetics and to specific organic causes, but most cases are essential hypertension, and it can be developed by chronically stressful conditions. And so chronic stressors can lead somebody to have high blood pressure, which in turn puts you at risk for those other diseases. We know that people who have type A behavior patterns also have more negative health outcomes. In one study they did of looking at people with type A and type B personalities, the people that ended up having heart attacks were only type A people. Those who were identified as type B people, none of them in this one study had heart attacks. And so people who have type A Behavior patterns have a sense of timed urgency. They have to do things really quickly. They get easily aroused and aggressive if things don't go their way. They're competitively striving for achievement even when they don't necessarily need to. There's always a pressure. It's like they can't take a vacation. As I mentioned, it is a high risk for coronary heart disease, and men are more likely to have type A personalities and other risk factors for coronary heart disease as compared to women. So by modifying hostility, we can actually improve cardiovascular functioning, and this is done through a combination of cognitive behavioral techniques, by reducing type A behaviors, kind of working with people using cognitive strategies to decrease thinking patterns that support type A behaviors. You can also work on relaxation exercises. You can help hostile participants express themselves in more assertive ways rather than hostilely, so they don't have a lot of that pent-up tension, and helps to reevaluate certain beliefs that might lead to urgent and hostile behavior. We do know that there's also a link between depression and coronary heart disease. One of these things might be that depression doubles the risk of recurrent heart attacks and mortality. And we find that depression is associated with reduced heart rate variability. Depression also encourages unhealthy habits like more sedentary lifestyles. People who have depression are more apt to abuse substances. So there's a lot of, eat poor diets, have worse sleeping habits. They therefore have decreased immune functioning, which then puts them at greater risk for heart disease. So increased physical exercise is an important target of intervention because we know that exercise decreases depression. It also decreases your risk for heart disease, and it's a good thing to do for your heart. So antidepressants or cognitive behavioral therapy actually have limited effects in terms of preventing coronary heart disease. A lot of it is kind of changing lifestyle, but changing lifestyle can be affected by using cognitive behavioral therapies to help people change their lifestyles. So in terms of helping people who have these disorders kind of improve the quality of their life, you want to help health-related behaviors, provide information on how to engage in positive health-related behaviors, so going to the gym, how to increase exercise, how to eat more healthful diets, how to sleep properly, how to eat properly. And you want to increase skills in self-efficacy beliefs. And we do find that participation is affected by cultural norms and such that certain cultures are not so supportive of these behavioral modifications, whereas others are, and so you have to take that into consideration when working with your clients. More recently, with the proliferation of the internet-based resources, we have the ability to provide these types of interventions online for people who cannot access in-person programs. These are also cheaper and better for people who have busy lifestyles. They're low cost and they can reach large segments of the population. The potential public health impacts of these types of programs is tremendous. I mean, even, for example, Weight Watchers now has Weight Watchers online. So if people who couldn't go to the meetings before can now do this type of thing online. So we're going to talk a little bit now about your sleep and your health. I assume most of you have had some sleep deprivation as you are young, you are partying, you are studying, you are working, you are doing a million things, and so sleep, you say sleep is for the old. Well, when you get older, you can't sleep anymore, and you wish that you were able to sleep like you did when you were young. So there are a lot of negative consequences of sleep deprivation, such as poor health, and many psychological effects like impaired memory. You'll see that very evidently in my behavior. Having 3 children and the lack of sleep that entails has significantly impaired my memory. I used to have photographic memory. I used to never have to write anything down, and now I forget everything. It affects your ability to learn new things. It affects your ability to do logical reasoning, math, complex verbal processing, hence my inability to come up with words in my lectures, and your decision-making skills. You're more irritable. There are more emotional ups and downs. You can have perceptual distortions. I know one of my friends, when her son basically was not sleeping through the night for several weeks on end, said she started seeing things. She wasn't I guess she was becoming mildly psychotic, but not to the point where she would have to be hospitalized or anything like that. And sleep deprivation can lead to death in certain cases. We know that there is a very strong interaction between sleep and stress. I don't know if it's ever happened to you where you wake up in the middle of the night and you're feeling stressed out and all your brain just keeps running through things, and it's like you want to go to sleep but your brain will not shut off, and that's related to stress. So here are your electroencephalogram recordings during various stages of sleep. This is kind of when you put electrodes on your brain, so you can see that when you're awake, there's a lot of activity. There's 4 stages of sleep and REM sleep, which is kind of, the sleep where you're dreaming. So you can see there are different brainwave patterns in the different stages. So sleep disorders are disturbances in sleeping or staying awake, and they can be caused by psychological factors, medical factors, and substance abuse. A lot of people think that taking substances will actually improve their sleep because people tend to pass out when they're drunk or have too much to drink. But it's actually drinking actually causes more sleep problems than it solves. So insomnia is a chronic difficulty initiating or maintaining sleep, or sleep does not restore energy or alertness. So people who have insomnia do not get enough sleep. Some of us have episodic insomnia, so we either have difficulty falling asleep or staying asleep at some points. It can last for a few days. Maybe it's in response to a stressor, something had too much caffeine, something's going on. But then more chronic insomnia is like when people are feeling depressed or have other psychological or medical issues. It can go on for a long period of time. It can significantly impair somebody. So there are cognitive behavioral treatments for insomnia. There's sleep restriction therapy, and then there's medication. You can take antidepressants, antihistamines, tryptophan, delta sleep-inducing peptides, melatonin, benzodiazepines. People generally have, medication is not a permanent solution generally. I mean, if you're having a situation, for example, if your husband or wife passed away, you lost a child, something very, tragic that's happened to you, no amount of cognitive behavioral therapy is going to help make you, feel better immediately. So it's only through the passage of time. And if that's significantly impairing your sleep, then you might want to, the doctor to prescribe something for you to get yourself through this difficult time. But if it's caused by stress, then cognitive behavioral therapy is really your best course of action. So what we often do is, if people wake up in the middle of the night because they're having insomnia, we tell them to get out of bed, because you don't want to associate your bed with restlessness, and you keep doing that. You also want to practice relaxation techniques, making sure that, in the several hours before bed you do relaxing things, no TV, things like that. If any of you have these problems and are interested, I can provide you with some literature, so just please email me. Hypersomnolence disorders and narcolepsy involve excessive sleepiness. So hypersomnolence disorders expresses an excessive quantity of sleep or a low quality of wakefulness. These are people who are sleeping way too much and are kind of drowsy almost all the time. Narcolepsy, on the other hand, is recurrent attacks of irrepressible need to sleep. So that's when somebody's kind of talking to you and all of a sudden, like, they kind of fall asleep. You've probably seen this in comedy movies, but it's actually quite, distressing if it happens to people, and it does. Cataplexy is a sudden loss of muscle tone lasting under 2 minutes. So it looks like narcolepsy, but the person kind of just collapses. So some of the symptoms of narcolepsy and cataplexy include lacking cells in the hypothalamus that secrete hypocretin, which promotes wakefulness. They've actually, I don't know if you remember the experiment they did with the cats, I think it was, where they destroyed this area in the hypothalamus and they could no longer sleep, and then they went crazy. Symptoms of narcolepsy without cataplexy include low levels of hypocretin. Biological factors implicated in hypersomnia and narcolepsy without cataplexy are low levels of histamines, and there's some genetic factors as well that are coming into play there. In terms of treatment, you treat with stimulants, which are the same medications that are prescribed for ADHD, sodium oxybate and selegnine, and antidepressant medications. So a lot of this, the fact that the primary course of treatment is medical, suggests that this is really a biological issue rather than a psychological one, and that medications can help. Then finally we have sleep-related breathing disorders. Central sleep apnea, which is a complete cessation of respiratory activity for brief periods of time while somebody is sleeping. This is largely happening in people who have obesity, and that their throat kind of blocks the air passage when they sleep in certain positions. Or you have sleep-related hypoventilation, which are episodes of decreased breathing associated with high carbon dioxide levels. And there's obstructive sleep apnea syndrome, people who snore loudly, go silent, and stop breathing for several seconds at a time, and then gasp for air. We then have circadian rhythm sleep-wake disorders. So this is when the circadian rhythm is messed up for some reason. That's like what causes you to be sleepy at a certain time and wakeful at other times. And so it leads to excessive sleepiness or insomnia due to their problem with their circadian wake-sleep pattern. So you can have delayed sleep phase type, which is a persistent pattern of delayed sleep onset and awakenings. So you have problems going to sleep or waking up earlier than you want to. Or there's advanced sleep phase type, which is persistent pattern of sleep onset and awakenings that are 2 or more hours earlier than desired, which nobody wants to do that. I can tell you that much. There's the irregular sleep-wake type, which do not have a discernible sleep-wake pattern, so it can happen at any point in time and day. And then there's the shift work type, which is caused by working rotating shifts or irregular hours such that the body doesn't really have a circadian rhythm anymore. There's actually evidence that people who work shift work have decreased life expectancy compared to others because of this disruption to the circadian rhythm, poor sleeping, things like that. I know a lot of us don't have choices if we want to work shift work or not, but just keep that in mind if you do have a choice, that it's preferable not to have to work to shift work and to maintain regular sleeping patterns. In order to overcome these disorders, you want to do behavioral interventions where you're making people go to sleep at the same hour. You're teaching them, sleep hygiene techniques, which I mentioned previously. And you also want to administer melatonin, which helps to promote sleepfulness at prescribed times to make people sleepy. Finally, we have disorders of arousal. So these are recurrent episodes of incomplete awakening from sleep that seem to mix elements of wakefulness and non-REM sleep. So we have sleep terror disorder. That's when a sleeping child screams, sweating with heart racing, and in the morning they have no idea what was going on, but they just scream, and it's like a blood-curdling scream. Their eyes are awake, but they're not really awake. Fortunately, I've yet to experience that with my children, but I've had friends whose children have done this, and they said it's terrifying. Then sleepwalking disorder, which are repeated episodes of rising from bed during sleep and walking about. And so there's also confusional arousals, which are episodes of incomplete awakening during non-REM sleep, which do not involve sleep terrors or sleepwalking. So there's also rapid eye movement, sleep behavior disorder. So behaviors during REM sleep are frequent and impairing. There's been violent behaviors that are characteristic of REM sleep. So we have these dreams, but our body becomes paralyzed during REM sleep so that we don't actually act on them. Although some people do not have this paralysis, and you've seen there have been episodes where they've attacked their partners in bed because they're dreaming and they don't mean to. And so the treatment here is antipsychotic medication or melatonin. Nightmare disorder are frequent nightmares causing distress or impairment in functioning because they impact people's ability to get a good night's sleep. In order to get a diagnosis, though, your nightmares must be frequent enough to cause significant distress or impairment in functioning. And the treatment is generally cognitive behavioral interventions with desensitization because there's usually recurring topics. This could be related to PTSD, but not necessarily. In order to get this diagnosis, you have to rule out kind of a PTSD. So then you want to expose people to their nightmares. And the last thing we're going to talk about today is restless leg syndrome. Some of you may have experienced this. It's kind of a creeping, crawling, tingling, itching sensation in legs that makes it difficult to sleep. It results in fatigue, mental health problems, and difficulty functioning because it actually keeps you awake. It's associated with specific genetic loci, so there's a genetic basis to it. There are abnormalities in the dopamine system and iron deficiencies. And so you can see that since all of the causes are biological in nature, the primary treatment here is medication therapy. And people have had some good success with prescribed medications.